Hi, I'm Scott Williams, Vice President for Men's Health Network. Today I'm discussing important issues in men's health, and now I want to talk about prostate cancer. The National Cancer Institute estimates that in the U.S., over 192,000 men will be diagnosed with prostate cancer this year alone. In addition, over 27,000 men are expected to die from the disease. That's one man every 19 minutes.
Prostate cancer is very common in the United States. It's estimated that 1 out of every 6 American men at some point in their life will face a diagnosis of prostate cancer.
However, a lot of men go on to live healthy, happy lives after prostate cancer. Often the key is early detection. So what are the risk factors for prostate cancer? Well, the disease is possible in any man, but there are a few things that put certain men at increased risk. First is race. African American men are 60% more likely to be diagnosed with prostate cancer and 2.4 times more likely to die from it. Second is family history. If a man has a family history of the disease, his odds of being diagnosed are doubled. Finally is age. As men age, they are at increased risk of developing prostate cancer.
We believe that prostate cancer screening, which is the PSA, prostate-specific antigen, and DRE, digital rectal exam, should begin for most men at the age of 50. For African American men, we advocate that it begin at the age of 40.
You should speak to your physician about the need for annual screening from then forward. And once you know your PSA score, write it down and keep track of any increases over time. It's important to note that prostate cancer usually has no symptoms. That is why speaking with your physician about screening is so important.
Well, one of the tragedies of prostate cancer is that in its early stages, it generally has no symptoms. Now, when prostate cancer becomes advanced, you may have symptoms like difficulty urinating, you may have blood in the urine, you may have blood in the semen.
Some men who have developed prostate cancer have painful or burning urination, persistent hip or back pain. So if you experience any of those symptoms, you should see your healthcare provider. Many of the things that are recommended to prevent prostate cancer are beneficial to one's overall health, like eating right, exercising regularly, not smoking, drinking lots of water, and relaxing and enjoying life. Remember, prostate health is just not about cancer. Other conditions such as prostatitis and BPH, sometimes called enlarged prostate, can also affect men as they age and their prostates begin to change. This is another reason why it's important to seek regular checkups and exams. If you want to learn more, check out our other videos on men's health, including what women can do for men's health.